Back with school in session and flu season just around the corner, local doctors are urging everyone to keep up on their immunizations. We're finding out why getting your vaccines are especially important right now. The COVID-19 pandemic has resulted in a decrease of clinic visits for many, which means some children aren't getting their recommended vaccines. But for mom of three, Lindsay Givens, precautions in place at Sanford Health Clinics have made her feel safe bringing her daughters in for their vaccines.
We're cautious and we use our hand sanitizer and all of that. So as long as we're careful, I am perfectly comfortable going into the clinic.
Sanford Health pediatrician Dr. Tracy Purett says every precaution is being taken to ensure patient safety. But some people still have concerns.
If we look nationally, there's been an enormous decrease compared to last year in the number of kids that have been vaccinated and went to their wellness visits. And that's terrible.
Here in Keloland, he's seen the effects of children not being immunized.
Even locally, I've had to admit kids for whooping cough. And that's certainly a vaccine-preventable illness.
Preventing illnesses is exactly why Givens says all of her daughters get vaccinated.
I think just knowing how it protects them and, I look at the disease itself and the side effects of that immunization to me far outweigh the risks with that actual illness, depending on what it might be.
And with flu season on its way during a global pandemic, Dr. Purett says avoiding vaccine-preventable illnesses is crucial.
If we're having very low vaccination rates, for instance, in influenza, we could have a very bad influenza year. And not only will we have the normal amounts of influenza in our hospitals, but then on top of that, when COVID-19 comes around again, we will have to manage that as well.
Dr. Allison Settle with Sanford Health is joining us via Zoom. Dr. Settle, the pandemic has thrown a lot of people's yearly routines off, including clinic visits and appointments for recommended vaccines. So what do you say to parents and students who may be concerned about coming in?
No, I think if you think about all the different areas that we go on a daily or a weekly basis for our routines, going to the grocery store, going to the pharmacy, running errands to Target, etc., going to the clinic is probably one of the safest places to go. We've got all of our staff are wearing masks and everyone is using proper precautions to really keep people safe. We also tend to do tests for individuals with COVID away from our clinic sites at our kind of drive-through locations. So we're trying to keep the clinics open for those healthy visits and those routine visits.
Are you seeing a decrease in people this year versus other years for coming in for any of these vaccines or just regular clinic visits?
We are seeing a decrease across the Sanford system. I would say it was early on in the pandemic that we saw the biggest decrease, and we are seeing numbers come back up. I think, we all were told early on just to stay home and not even go to the grocery store, do those basics. I think there's a comfort level that people are developing around getting out, and they've figured out a way to do it safely. And that's the key, is have your plan and then still do it. I do think one of the most important things to do is keep up with that health care so that you're as healthy as you can be going into flu season and during this pandemic in case you do get ill.
And if a large amount of people do miss out on these vaccines that are recommended, what could happen?
Well, we've seen it happen in other scenarios where there's pockets of individuals that choose not to vaccinate for things like the measles, and then we have outbreaks of measles. So these are not atypical when we have groups of individuals choosing not to vaccinate. That decreases the herd immunity, and then we can have increased vaccinations. So if we layer that on top of this pandemic and we have kids that are missing their shots, then they have to kind of start over with that vaccination process because it's a series of shots, and that makes them susceptible to some of these other illnesses.
It can be pretty easy to only focus on the coronavirus right now, but we're also moving into flu season. So why is it so important to get the flu vaccine, especially this year?
Yes, so the flu vaccine is tried and true. We've had it out and been using it for years. It changes every year, and getting it every year helps you develop immunity and maintain immunity. So we encourage the flu shot every single year. Why it's important this year more so than other years is the flu and COVID look a lot alike. So when you're going into your doctor with symptoms, or you're calling into the clinic with concerns with symptoms of a fever and body aches, it can be hard to tell the difference. But it matters. We want to know if you have the flu or COVID, because that depends on if you need to isolate or quarantine, etc. So we will be testing. We'll be able to test for both flu and COVID throughout the season. But if you've had a vaccination to the flu, that helps us know this is more likely to be something else, and we need to be careful. We need to test for COVID and make sure everybody's okay.
Do you have any concerns about maybe hospitals getting overwhelmed when COVID kind of gets thrown into the mix with flu?
You know, we've taken a close look at it and looked at our numbers for previous years of the flu and how many individuals we have hospitalized, how many tests we do in the outpatient clinics. So we're anticipating, just like we did when COVID first came, what's that worst case scenario? What do we need to be ready for? And then let's hope for something much better, so that we have that cushion, or we have that ability to handle. So we're feeling pretty confident. And what we're hearing is, particularly with influenza, we always look at the other half of the globe, because they're having flu season sooner than we do. So we look at Australia and these other countries, and we're finding that what their rates are and how good the vaccine is this year. And that helps us also predict what we'll need for this coming flu COVID season.
There's a lot of work going into developing a vaccine for COVID-19. So how far off could we be from a vaccine being widely available?
You know, I don't think we're that far off. And that's something that I think gives all of us hope, to think about a future where there is a vaccine, where we can start maybe planning 4 months from now, taking a trip or doing something because we've reached that herd immunity. We've been in constant contact as a health system with our state departments of health in creating that plan for mass vaccinations and the ability to roll that out. So we're ready to do it. We did this with H1N1, and very successfully, I might add, as a state of South Dakota, with all the health systems and the Department of Health. So we're ready to do it again whenever that vaccine becomes available. The fact that they're having us be totally prepared, I think, means that a vaccine is likely to come this fall or this winter, and that mass vaccinations will be occurring this winter and spring.
Now, even if the vaccine does come, do you think that people will be worried about getting that vaccine, about the safety?
Yes, I think we have people that are worried about all vaccines. And I think there's been a lot of discussion about this particular vaccine, and are they following the proper steps to take to get to a safe vaccine. And I've been following that closely, because obviously we want to make sure this is a safe vaccine. And from everything that I've been seeing, they are taking all of the proper steps. They've been able to kind of overlap the steps. So that's why the time is shorter, but they're not avoiding any of the steps.
All right, thank you, Dr. Sundel. From vaccines to physicals, coming up after the break, we look at how there's more than COVID-19 when it comes to thinking about your students' health.